Dr. Kate Archer. I'm a facial plastic surgeon, perform exclusively plastic surgery of the head and neck. I specialize in cosmetic and reconstructive procedures of the face, neck, and nose. Brevard County became my home in 2016 last summer when my fiance and I moved down here. The Space Coast and Treasure Coast are wonderful places to live and work and raise a family, much more than we could ever imagine, so we're super excited to be here. My passion and my goal in terms of my practice are empowering men and women every single day through positive changes. Ways that I do that are helping veterans with head and neck examinations in the clinic. I take trauma call at Wusthof Rockledge and Wusthof Melbourne. I'm on call right now, so everybody please be careful driving home. That's just where I came from, so I apologize I was running late. And helping victims of domestic violence. We see them through the emergency departments in terms of taking facial trauma call for the last 7 years, and as well as a number of wonderful organizations that we have throughout our communities here. So that's always been an important part for me. So in terms of my talk, I'm going to talk about a little bit who I am, what I do, what is modern facial plastic surgery, which is the type of plastic surgery we practice, different advances, what's the latest and greatest, a couple of the classics, and our special concierge package, which is curated really specifically with Vero Beach patients in mind. So I was born in Canada but grew up in Arkansas. My family still lives there. This is our farm in the northwest of the state. We raise black Angus beef cattle, chickens, ducks, honeybees, cats, and everything in between. We have 2 new additions just this week, 2 German Shepherd puppies. This is my sister, and this is Atlas and Spike. So they're going to be protecting our chickens. I did college in Arkansas at Hendrix College, it's a small liberal arts college, medical school at the University of Arkansas. I did a residency in head and neck surgery at SUNY Upstate in Syracuse, New York after that. I've been complaining all day about the weather outside, but this is what Syracuse looks like right now, so it's not all that bad in terms of what we have going on right now with 60 degrees, which ironically feels like 30 now that I've been down here for 7 months. Early in my career, I've always been very fascinated by the combination of function and form when it comes to facial plastics. With rhinoplasty, the nose has to breathe well, it has to function appropriately, but you also want it nicely balanced on the face. When it comes to trauma, ironically, you want to repair the jaw so it works, but you also want to have the appropriate horizontal and vertical buttresses so it goes back and fits the face with nice balance as well. I've done a mission trip to Ho Chi Minh City in Vietnam with different mentors that I had in my fellowship and residency program, and with all those situations and all of those experiences combined led me towards doing a fellowship in facial plastic surgery in Indianapolis with a focus on the cosmetic portions of aging face as well as more trauma, of course, rhinoplasty and skin cancer reconstruction. I'm board certified in head and neck surgery and am in the certification process for facial plastic surgery. I am a member of a number of professional societies, both nationally and locally. We're working with the Brevard County Medical Society to make this area an even better place for physicians to live and work with their families. All of that is great in terms of credentials, but it really doesn't amount to anything unless you are having and creating happy patients along the road. We know that from the moment a patient walks into our office, into our practice, we have to provide a really high quality level of care. We have to earn our patients' trusts and be on that very special journey through facial plastic surgery with them the entire way. And through that, we've been able to create a lot of happy patients, a great practice where we're proud to work, and that's with every one of our staff members. We have that. What is modern facial plastic surgery? Modern facial plastic surgery is a comprehensive and multidimensional approach to the face, and it really is a shift in how we think about the aging face. A lot of traditional plastic surgeons will talk to you about surgery because they just want to address that lifting component, but what we've learned is that there's so much more that happens with the face in terms of the skin, the collagen, volume, and gravity. We promote prevention and maintenance as much as surgical treatment options. So when you come to see us in the office, we'll not just talk to you about surgical options, but also options about vitamins for inside-out wellness, the right skin products to be on, sunscreen, volume, and gravity, because everybody falls somewhere on this spectrum, and anywhere you are on that spectrum, you can benefit from all of these different things in terms of long-term facial wellness and health. We love vitamins for skin wellness. There's all sorts of great things that we're learning in terms of new research out for what these organic different options can do for your skin and your face. Sunshine is a big, big deal, of course, when it comes to our patients living in Florida, living and working here. What we're learning more about sunshine is how it affects the skin and how it changes the skin. And photoaging is totally different than chronological aging when it comes to your skin. UVA rays are the ones that go through window glass and cause aging. UVB rays are the ones that can't go through glass, but usually cause the skin cancers. Oh, it's a little bit broken out here, but this is a gentleman who presented to a dermatologist, and his picture was published in the New England Journal of Medicine because of all of this. Here. Are you guys able to see that a little bit? So does anybody know what this guy did for a living for the past 27 years?
Truck driver.
He was a truck driver. That's right. So it just goes a long way to show what sun damage specifically can do to your skin. And we're learning a lot more about that. In terms of sunscreen, SPF means how well does it work? You want a broad spectrum sunscreen that covers the A's and the B's. SPF 30 blocks 97% of sun's rays. We don't have any good research that shows SPF of greater than 50 is any better than under 50. So our recommendation is always SPF 50. Remember that when it's cloudy outside, the sun's rays still get through. Zinc oxide is the most important component when it turns to sunscreen. Zinc oxide on this graph here you can see has the broadest coverage between the UVB and the UVA rays, so that's our favorite component. Let's talk a little bit about what's going on in terms of our new favorites in facial plastic surgery. One of the big things that people are talking about now is PRP. Has anybody heard about PRP? So PRP, oh good, it's platelet-rich plasma, and it's all about the platelets. That's really the core component to it. What we know is that when platelets are in an area of tissue injury and healing, they go from a resting state to an active state. And when they're in the active state, they just explode all of these wonderful growth factors. And that's the same sort of serums that we put on our skin, that are in all of our skincare products. And platelets do that organically. So what PRP is able to do is harvest just those platelets. And when you add the platelets into an area of injury, be it a laser, microneedling, surgery, they organically release all of your own growth factors into the area to boost the healing process. Indications for using PRP that we do at the practice include for hair growth, in terms of thinning in the temples, at the top of the scalp, with surgery, and with microneedling, specifically to build all of that wonderful collagen that's being broken down by the aging process and by sun damage. This is a study that was done that showed that microneedling, which is little needles that are used on the skin with topical anesthesia, produces a 200% increase in new collagen, but if you take microneedling with PRP, it's 1,000% increase in new collagen. So it really does take this idea of that skin treatment and prevention to a whole new level. So other than PRP, our new latest and greatest favorite thing is a technique called the Silhouette Insta-Lift. It's a suture procedure that lifts deep tissues of the cheeks. It addresses heaviness in the cheeklet grooves, downturned corners of the mouth, jowling, and the marionette lines. The downtime is 1 to 2 days. Usually you have a touch of a bruise and a little bit of swelling. It's really great for the patient who's done some fillers, has nice volume, but the fillers aren't really enough to get the gravity component of aging, but they're not quite ready for surgery. So this is sort of where that's positioned in our practice. The cones are from medical suture material, so they degrade over time. They promote a little bit of an inflammatory reaction as they dissolve, and it builds new collagen in their plates. So it's not a permanent result, but ultimately that also decreases the risk of infection and the sutures extruding out of the skin after 5 years. This is a patient from my practice who was concerned about the deeper cheeklet grooves here, the marionette lines, heaviness along the jowl and downturned corners of the mouth. And this is immediately after the procedure, where this is softened, this is softened. There's just a much vertical look to the cheek, and then the jawline is improved as well. A portion of all the proceeds that we do from each silhouette Insta-Lift from now until the end of time are going to the Brevard County Sheriff's Office to promote their campaign to fight domestic violence in Brevard County.